Hello. So my today's topic is hip joint. In this hip joint, I will cover the ligaments of the hip joint. So there are basically nine types of ligaments are all around the hip joints. The name of the all ligaments is iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament, ligamentum teres, transverse acetabular ligament, acetabular labrum, sacroiliac ligament, lingual ligament, obturator ligament. These are the ligaments of the all around the hip joint. First, iliofemoral ligament. The location of this ligament is the anterior aspect of the joint and the between of the ilium and femur. In the between of ilium and femur, the iliofemoral ligament will be the location of the iliofemoral ligament is there. The function of this ligament is the strongest ligament of the body and it prevents the hyperextension of the hip when standing. When the person is standing, at that time, the hyperextension of the hip will be subsided by the iliofemoral ligament. It will also assist in maintaining upright posture without muscular support. So it is very useful for standing purpose, and we can say that for the stability, this ligament will use. The kinesiology inside will be the provide passive stability during standing and limits excessive external rotation and extension. The second is the pubofemoral ligament. Location of this ligament is the anterior inferior aspect, and it is located between the pubis and femur. The function of this ligament is the limits abduction and extension of the hip and reinforce the joint capsule inferiorly. The kinesiology insight is to help the control the hip abduction during walking and stance phase. The third one is the ischiofemoral ligament. The location of the ligament is the postural aspect between the ischium and the femur. The function of this is to limit the internal rotation, like this internal rotation and the extension of the limb, and it will also help to stabilize the joint posteriorly, means at the backward side, it will help to stabilize the joint. The kinesiology insight is to important during dynamic activities like twisting or pivoting. Now, another ligament is the ligamentum teres. Location of this is the runs from the acetabulum, means it will start from the acetabulum. It will end at the heads of the femur inside the joint capsule. Means at the capsule of the head of the femur, at the joint capsule, it will end, and the starting of this ligament is from the acetabulum. The function of this is to provide the minor stabilizing role and contains small arteries that supplies blood at the femoral head in the children's. The kinesiology insight is more relevant in early life, become less significant in the adults. As you see here in the function that it will supply the blood at the femoral head in children. So it will use in the early life, but in the adult life it will not useful so much. Now, the another ligament is the transverse acetabular ligament. The function of this is the bridge the acetabular notch, completing the rim of the acetabulum. The kinesiology insight is to convert the acetabular notch into the forearm through which blood vessels and nerves passes. Also helps stabilize the head of the femur within the acetabulum. The another one is the acetabular labrum. The fibrocartilaginous rim attached to the margin of the acetabulum means this is the location, or we can say the place where this ligament is present. The function of this ligament is that depends the sockets and increasing joint stability and helping to distribute the load. Means it will distribute the uh, force or loads of the body to the different area. The kinesiology insight is to critical for hip joint congruency and the proprioception and the prevents the dislocation. Now the another this is the acetabular labrum is also known as the supporting limb nearby, and it is not directly part of the joint capsule. The sacroiliac ligament is the anterior and posterior sacroiliac ligament stabilizing the sacroiliac joint. While not part of the hip joint, means the sacroiliac ligament is not the particular part of the hip joint, but it will help to stabilize the certain areas of the hip joint all around the. It will influence the pelvic stability. As I say that it will not part of the hip joint, but it will stabilize the surrounding area. So it will influence the pelvic stability, which indirectly affect the hip joint mechanics. Now, the another ligament is the inguinal ligament. It will start from the ASIS to the pubic tubercle. ASIS means the anterior superior iliac spine, and from the anterior superior iliac spine to the pubic tubercle, the location of the inguinal ligament is there. Not stabilizing ligament of the hip, but forms the floor of the femoral triangle and serves the landmark in the clinical and anatomical studies. Now, the obturator ligament, it covers the obturator foramen leaving the small canal from vessels and nerves. While not a major hip stabilizer, but it forms in a boundary of the pelvic wall near the hip joint. This ligament is also not part of the hip joint completely, but it will help to stabilize the bow or make the boundaries around the pelvic wall near the hip joint. Thank you. So I will cover the ligaments of the hip joint, and these are all are the ligaments which is present all around the hip joint and working as to give the stabilizing stability all the around the hip joint. So I will cover all the ligaments. Thank you. I am the Sanjay Hitanshu from second year B physiotherapy. Thanks a lot. Here's my turn. Oh, thank you.